Well, hello, it's Dr. B here. And as we close out the month of April, I want to take a few minutes to talk about stress. Now, April is Stress Awareness Month, and I already talked about it, but I want to kind of come back and just have a little bit more general conversation as we close out this month. And I think it's important that we do our self check. We need to check in on ourselves. So, what is stress? Stress is your body's natural process to deal with pressure and demands that we may face. And you have a couple of types of stress. We have chronic stress and acute stress. Now, acute stress is usually short term. You have a short term stressful situation that you have to deal with. You got a hard deadline at work that you're working on. You got a transition that you got to make, or a major decision you have to make. But it's just short term stress. Then you have chronic stress, and that is stress that lasts for greater than 6 months. Okay, and that can be anything. It can be financial, marital, relational. It can even be career stress or work related stress, family stress with your children, or dealing with a sick or ill parent or family member. So that chronic stress lasts longer than 6 months. So how can stress affect the body? Well, let's talk about some physical things. Stress can cause headaches, fatigue, migraines, insomnia. Um, Emotionally, stress can cause anxiety, irritability, and even hostile behaviors. Um, and then also behavioral. Stress can lead to overeating, over drinking, and even substance abuse. And people using drugs to cope, or drinking alcohol to cope. Over eating, of course, and we call it stress eating. Okay. And I've already kind of went over briefly, but what are some things that can cause stress? And we talked a lot. The last time I did this, I talked about work stress. So work overload, too much going on at work, unorganization, chaos, a lot of changing of the guards, new management, new employees coming in. Then you can also have financial stress. And we know, especially now, finances are getting hard for a lot of folk. With all the tariffs, the cuts, and job loss, that can be stressful. Family responsibilities. You have to take care of an ailing parent, or ailing family member, or a child, or just too much, just trying to get a child out of college is stressful. So family responsibilities, every day-to-day responsibilities. I was talking to someone the other day, and they were talking about their house note has doubled in the last year. And I know my house note went up a lot too. And I know it can be stress if you don't have that extra income to, pay that extra money every month. Insurance premiums are going up, property tax, and food costs. I mean, food costs is astronomical. Like, you don't want to eat now because you're gonna cut back on food, cut back on eating, because it's so bad. Then you can have health issues, can cause stress. You get a diagnosis, a new diagnosis, or one that's getting worse. That can cause stress. And I think I just definitely want to talk about global uncertainty. We don't know what's going to happen. And that happens when you get a new president, new governors, that kind of thing. But the uncertainty of where we're going can be very stressful. Now, what are some signs and symptoms that you have stress? Okay, I talked about earlier what stress can do, but let's talk about some signs and symptoms that you could have stress. Are you having those headaches out of nowhere? A lot of tension, a lot of neck pain physically, getting sick a lot and frequently. I could say that your immune system is weakened, Muscle pain, especially in your head and your neck and your shoulders. That's tension, we call it, can be an issue. And emotionally, what are some signs and symptoms that you have some stress? Mood swings, irritability, feeling wanting to be isolated. You don't want to be around anybody. You're feeling overwhelmed. Um, those can be some signs of that, emotional signs that you have some stress. And behavioral, which you got to look at. Stress can be procrastination. I just don't want to do this, and you put it off to the last minute, and then you really got to work, right? Withdrawal, isolating yourself from other people. Used to be like this social butterfly, but all of a sudden you're just at home, working home, work, church, and home. you know, that can be a sign that you're stressed because you've withdrawn from your normal activities. Um, uh, just eating and you're not hungry. That nervous thing, just eating, you're always snacking, you got something in your mouth. Um, Drinking to go to sleep. Gotta have me a glass of wine so I can go to sleep tonight. Could be a sign that you have some stress. Okay. And for sure, overeating is definitely a sign. Um, so take a look at yourself and, like, what am I doing different? How do I feel? Like, for me, I know I'm stressed because when I can't sleep, yeah, I got to take a Lunesta or take a Tylenol PM just to give me 3-4 hours of sleep because I got so much going on. What are some signs that you exhibit when you're having a lot of stress? Now that you know how stress, you've kind of thought about how stress looks, how does it show up in your life, let's talk about some things that you can do to manage stress. And this is important because I don't know nobody that's not under stress right now. And so I think we need to really sit down and take some time and kind of look at what can I do to manage this stress, okay? These hard deadlines at work not going nowhere. The president going to be there for 4 years. What can I do to manage the stress? And so first thing I want you to do is take a breath. Breathe. Do some deep breathing exercises. Literally focus on taking a deep breath in and taking a deep breath out. And you want to do this throughout your day. Okay? And I tell people to take a deep breath in, and take some time to blow it out. Don't just blow it out. Take a deep breath in and release it. Blow that stress off. And I usually say do it over 4 to 7 seconds. Just take some time to breathe. And when you feel in stress, your neck is tight, your shoulders are tight, just stop. Take a deep breath and breathe. I have on my desk, and I also have it when I'm giving a nursing exam or an exam at work. I have this aromatherapy lotion. The stress relief one from Bath and Body Works in a green bottle, and it's at work on my desk, so I don't have it here. But I tell the students to get some. It's eucalyptus and some other stuff, and just take a deep breath in and blow it out. Aromatherapy works. So get the eucalyptus, get the diffuser, and get it in your office to help release the stress, and even some lavender. Aromatherapy does work. You want to move. You want to walk 10 minutes. Or walk in, or just stand up at your desk and stretch. Okay, get up out the seat. Take a step out of your office. If you work in an office or a cubicle, just move away from it. Go walk around for a few minutes. If you're not anywhere that you can leave, like some of my nurses, they can't just leave when they're stressed. You can go to the Pixie's room, go to the break room for a minute. Sip on your water when you're in there. Just take a deep breath and get out of the stressful situation that you're in for just a moment. We're not abandoning our patients. Tell your charge nurse, I just need a minute. And step away. But also, for your lunch break, I need you to leave the floor. Nurses, anybody that's working in the hospital, Don't eat lunch in the break room. Go downstairs. Go sit outside. Eat your lunch. Get away from the area for a moment, okay, to kind of separate yourself so you can do a mental reset, okay? And take your break. I know somebody, I heard somebody in the spirit say, but I don't even get a break. You need to take a break. Every employee is required to give you a break, okay? So take your break. You got to learn how to manage your time and get off that floor, get out of the area for a moment wherever you're working, out of your office, and just take a breather and walk around. Get out of there. Make sure you're eating well. Make sure you're nourishing yourself. You're drinking water, um, and have some healthy snacks. Not something that's going to make you crash. A high carb snack is going to make you crash, okay? And you're going to even feel worse. And you don't want to do that. Make sure you're eating well-balanced diet, and drinking enough water, okay? And connect. Talk to other people. Talk to your colleagues. Even if you have a counselor, make sure you schedule regular time with that person. Make sure you're dumping that stuff out of you. Don't keep it inside, okay? Release it, okay? And if you're a nurse, healthcare provider, we do have to be mindful of patient confidentiality, HIPAA, right? So we're not going to share patient information, but you can share the situation. I was overwhelmed at work because we usually get 4, but today I had 6 patients and I just couldn't seem to get it together, and there was no help. We were short, that kind of thing. Talk to somebody. Yeah, you need to talk to somebody. Talk to a counselor or a therapist even. And then faith and mindfulness. And I know it's a lot of people that do not believe in God, do not believe in the Most High. And I really can't help you if you don't on that. I could just tell you that He's real. But you have to have your own faith. And so those that are believers, you need to be praying constantly, meditating on the Word. The Bible tells us to meditate on this Word day and night. Find your scripture that gives you peace, okay? And read those scriptures. Meditate on those scriptures. Print them out and just have it in your work bag or on your desk. And when you feel stressed, look at it, okay? And there are some scriptures that do focus on stress. One of my go-to scriptures is Philippians 4:6. And it reminds us not to be anxious for anything. In every situation, make our requests known to God. So in prayer and supplication, we got to pray. We got to tell Him, I'm stressed right now. This is hard. And then it also says, let me see. And it says, in the peace of God that surpasses all understanding. That peace, that's that peace that we need. So make sure you have your scriptures, if you're a believer, that you go to when you're stressed. Here's another one. Let's see, Matthew 11:28. And it says, come unto me all who are heavy laden and burdened, and I will give you rest. For my yoke is easy and my burden is light. That scripture reminds us that Jesus invites us to exchange our stress with Him. Give it to Him. Okay? And then there's another scripture. Let me see if I can find it. The one in Isaiah. I can't remember what it is, but it's Isaiah. It says, you keep your mind, He will keep you in perfect peace. Those whose mind is stayed up on Him. So thinking about God, let me pull it up. I got to pull that one up because I want to tell y'all exactly what it says. Okay. Isaiah 26:3. And it says, you keep him in perfect peace, whose mind is stayed on you, because he trusts in you. And this scripture focuses on the trust in God that He's going to bring stability and peace into our lives. So make sure you find scriptures. There's a one on anxiety in Psalm 9, I think it is. That's a good one. And First Peter also has a good scripture for you um, to um, to use, and it says for us to cast all our cares upon him because he cares for us. And so when we're dealing with stress, it's because we're holding on to it. We got to cast our cares on the Lord. Give it to him. He can bear the burden better. Okay. And I know that some is going to say, well, you got to deal with, yes, you do have to deal with it. Do your part, but also cast those cares upon him because he cares for us, and he will take care of us. And we have to deal with this stress because it will kill you if you don't. So prayer, journaling, and remember scripture reading and meditating on scriptures. And like I said, the Bible tells us to meditate on the scripture day and night. That means all day long, y'all, day and night. So meditating on that word, helping us cope and deal with the stress. And so I wanna give you some action things to do. Take an inventory of the stress that you're dealing with in your life, and look at ways that you can reduce it or eliminate it. A while back, I did a quick little 5-minute talk about making a hard reset. And, there's a reset when you just kind of got to regroup and get stuff together. But then sometimes we have to make a hard reset. And if you're in a very stressful situation, you might have to do a hard reset. And so let me tell you what that looks like. So if you're in a relationship that's very stressful, you might need to rethink that relationship. And I'm always careful to say, but if you're married, but even if you're married, you need to rethink this relationship. How is this relationship, this marriage, affecting me right now? And is killing you? Then you might need to really rethink that. What about counseling? What about therapy? Have you considered those things to make your relationship better? I'm not saying just throw in a towel. Have you done the work necessary to remove the stress if it can be removed? Sometimes people have a lot of stress in marriage because they married wrong. I know I'm going to get some backlash, but yeah. So sometimes you got to make some hard decisions. What about a job? If your job is stressful, let me tell y'all something. Don't quit your job because they hard, right? Some jobs are hard to come by. But if you're a believer, ain't nothing impossible for God, right? So maybe you got to move around. But plan. Don't just walk out on your job without a plan. Don't be foolish. Maybe you need to look for a better place to work. And then I noticed something on LinkedIn because I was on there looking. And I noticed something. You can go and look and see what the employees say about that place. Yeah, you can go in there when you're looking for your new job. Don't go from the fire to the fi, So you got to still, do some work. If it's your job, you might need to go back to school. You might need to go get a certificate, get some more training so you can be more marketable and get another job. But yes, jobs are really stressful right now. We don't know what's going to happen from today or tomorrow. But do the other things. Take your break. Take your vacation. When it comes to work, somebody told me if they didn't use 138 hours, they were going to lose it. That's 3.5 weeks of vacation that you didn't take. Why? Take your vacation time. And if you can't sell it back, if you're going to lose it, you should have been taking it all along. Who going to let you be off? What employee going to let you take all your vacation and be off for 3.5 months? They not. So you need to be taking some time off as you go. Take your vacation. Take your holidays. Take some mental health days. Most employees that I know have some. Okay? So work stress is major for us right now, but we do have to take some time. Okay? Check in with yourself to see where your stress is. If it's a job relationship we talked about, I think in the other video I did, I talked about church stress. I had a lot of church stress. I got the hell out of there. I did. And I don't have it no more. don't have no more church stress no more. No, I don't. I'm at peace too. I'm happy. So, what is it? Your children stressing you out? Sit them down and have a conversation. Grown or not. Because, yeah, grown kids cause stress too. Talk to them. Talk to those kids about, their behavior in school. Talk to them and get them some therapy and counseling. See why they're acting out. What is going on? Do a hard reset. Find ways to eliminate the stress that you have. You got to deal with it. You got to do the work. Don't keep just pushing it on the rug, because eventually the pile under the rug is going to get so big, you're going to walk by and you're going to fall. And it's going to be hard to get back up. So April was Stress Awareness Month, and I just want to come back on it because we had a good conversation on yesterday and today about stress, and I wanted to make sure I revisited it and talked about it a little bit more. Find out what your stressors are and look at ways to manage it. And if you can't figure it out, call your employee assistance program or your therapist or your counselor and get you some help. All right. Bye for now.